Inflammation is a critical homeostatic process that is activated by cellular injury regardless of the mechanism of that injury. Inflammation is essentially local in nature, although cellular mediators released during inflammation may initiate systemic responses as well. Inflammation is defined as the local response of living mammalian tissues to injury due to any agent. It is a body defense reaction in order to eliminate or limit the spread of injurious agent, followed by removal of the necrosed cells and tissues. Inflammatory processes are defensive or adaptive by design. However, they may contribute to distressing clinical manifestations of disease. Inflammation does not mean infection, even when an infection causes inflammation. Infection is caused by a bacterium, virus or fungus, while inflammation is the body's response to it. Any injury, including an invasion by microorganisms, causes inflammation in the affected area. Inflammation, a complex reaction, results from many different conditions. The damaged tissue releases substances that cause inflammation and that direct the immune system to do the following: attack and kill any invaders, dispose of dead and damaged tissue, begin the process of repair. Depending upon the defense capacity of the host and duration of response, inflammation can be classified as acute or chronic. Acute inflammation. Acute inflammation is of short duration and represents the early body reaction and is usually followed by healing. Examples of diseases, conditions and situations which can result in acute inflammation include acute bronchitis, acute appendicitis, etc. Chronic inflammation. Chronic inflammation is of a longer duration and occurs either after the causative agents of acute inflammation persists for a long time or the stimulus that induces chronic inflammation from the beginning. The characteristic features of chronic inflammation are presence of chronic inflammatory cells such as lymphocytes, plasma cells and macrophages. Macrophage, phagocytic cells, derived from monocyte, walls of blood vessels and in loose connective tissue. They interact with lymphocytes to facilitate antibody production. Examples of diseases and conditions with chronic inflammation include asthma, chronic peptic ulcer, tuberculosis, rheumatoid arthritis, chronic periodontitis, ulcerative colitis and Crohn's disease, chronic sinusitis, chronic active hepatitis.